Local news, a serious respiratory illness has attacked hundreds of children across the U.S. Health officials believe enterovirus, or EVD68, is causing this illness. At least 10 states are seeking help from the Centers for Disease Control and Prevention. Many are alarmed because this particular strand of the virus is uncommon. Dr. Amesh Adalja is an infectious disease physician at the University of Pittsburgh Medical Center, and he joins us from there to help us understand this. Thank you so much for being here, and it's good to see you, Dr. Adalja. First of all, tell us about this enterovirus. It's called EVD68. What type of virus and how does it normally behave?
So enteroviruses are just a general class of viruses that also include the common cold virus, and they usually spread in the same manner through people's coughs, colds, through droplets that people may emit. This particular one, enterovirus 68, was discovered in the 1960s, but it really just caused sporadic infections. And this new outbreak that we're seeing in the Midwest is an example of this virus behaving a little bit differently than it has before, sending a lot of kids to the hospital and some into the intensive care units.
And as I understand it, many of the kids that are affected, particularly those that go to the hospital, also have some sort of underlying health issue, particularly asthma. Why is that?
Well, we've known for a long time that anybody that has any kind of compromise of their respiratory system is much more vulnerable to having a severe infection with any virus. And with this enterovirus 68, it's no different. And a large proportion of those that are being hospitalized do have asthma. So that really underscores the need for those with asthma to be very vigilant about what goes on, what kind of colds they get, and being able to see their physician as soon as possible when they do develop a cold in order to prevent these kinds of complications from happening.
Amish, this seems to be happening right now in the Midwest. Why? Why this geographical part of the country?
It's hard to say exactly why. Viruses behave oddly sometimes, and it may just have to do with where the virus first appeared and the fact that schools open at different times in different parts of the country. And from what I understand, in some of those areas, the schools may have opened a little earlier than in other parts of the country. But we will probably see this virus in other parts of the country as people are more attuned to it and start testing for it.
As with the virus that causes the common cold, there is no cure for it. So what's the standard of care when a child does get this?
Well, the standard of care is going to be supportive care. So if a child is hospitalized, it's going to be things like oxygen, special medications to stop them from wheezing, those types of stuff when they're in the hospital. If people just have it, but most of the cases are either going to be asymptomatic or going to have really mild symptoms. It's just those ones that are in the hospital where you're going to need oxygen, and maybe some will end up on a mechanical ventilator.
So how dangerous is this infection?
For the ordinary person, it's not so dangerous. Like I said, the majority of cases are either going to have no symptoms or be very mild. But for those with underlying lung disease, it could pose a serious threat. And that's why people need to be vigilant and start thinking about this virus when you have a child that has some underlying respiratory condition like asthma and then develops a cold. And you have to treat that aggressively with maybe using their inhalers more often, getting them to see a physician more quickly than you would, and not really waiting this out like people are used to doing with normal colds.
We have a screen up for our viewers to see some of the symptoms. Talk us through what the typical symptoms are and when a parent should really get worried.
So the typical symptoms may include cough, runny nose. Not so many have fever, but fever could occur. Sneezing, those normal cold symptoms. But in an asthmatic, for example, they might have shortness of breath, wheezing. And once you start to get shortness of breath and wheezing, that's when you really need to worry that an asthma attack may be triggered by this virus.
And should we just automatically expect this to march right on across the country?
I think that this virus will probably do that. It's too early to say, but we know that enteroviruses are very ubiquitous. We have tens of millions of cases every year with enterovirus. This particular virus hasn't really appeared so often, but there's nothing that really will prevent it because it does spread very easily through, just like the common cold, and people may be asymptomatic but still shedding the virus, spreading it to others. So I do expect we will see this in all parts of the country.
I'm glad to hear you say that it spreads very easily, just like the common cold. It seems, though, that it's spreading even faster than the common cold. Is it more infectious than other viruses that we're familiar with?
It's probably about the same degree of infectiousness. Like I said, it's in the same family as the common cold, so it's going to spread almost identically to it. And the big thing is that people may have this virus and not have any symptoms, and then spread it to other individuals. Maybe someone who has asthma may pick it up from somebody who has no symptoms, and that underscores the need for good hand hygiene, frequent hand washing, covering your mouth when you cough and sneeze. The same simple public health measures we do during influenza season would help stop this virus from spreading.
Dr. Amesh Adalja, thank you so much. It was great information. We do appreciate it.
Thanks for having me.